It's the local spotlight show here at WJBM Studios in Jerseyville, Illinois, the voice of the Tri-Counties. I am Chris Lorton. I am your host, and with me today, I'm happy to have kind of a newcomer to town recently, Kevin Zachary, the CEO of JCH HealthCare. Welcome, Kevin.
Thank you, Chris. Glad to be here, and glad to be a new member of the JCH team and member of Jerseyville community.
Yeah. When did you come on board?
I came on middle of June. I would say I full time came on middle of July, and have been here ever since.
Yeah, I think the first time that I kind of saw you, and I actually might have shaken hands that day, was the duck race that we had at the.
We did in Grafton.
Grafton.
Yeah. That was a lot of fun and a new event for me, and look forward to continuing that in years to come.
Yes. Now, Kevin, where do you originate from?
I'm originally from a town very similar to Jerseyville in the Panhandle of Texas. It's named Freona. It's a much smaller community, but very very similar type of folks, and that's where I'm from.
Yeah, I think I noticed a little draw there.
I can't hide it.
You can't hide it. So are you wearing cowboy boots too?
No, they're in the closet.
Okay. So small town in Texas. When you were in Texas growing up, did you always think you were going to be in the medical field?
Not at all. I grew up in a little local lumberyard and thought that would be what my profession was. We were never in agriculture, but the whole economy was based on ag, and so we supported it. And I really thought it would go that path. But once I got into college, I started out as a paramedic and really found interest in that aspect, and then went on to nursing. And then that led to deciding management was where my passion was with rural health, and the rest is history.
How about when you were in college? What did you study?
So I started out as a paramedic. When I was a freshman in college at a community college, and then that led on to working in a really busy ER, and some coworkers introduced
right off
me to
the
nursing.
Bat, you got into this action, huh?
Yeah, right out of high school, and then became an RN and worked in primarily trauma and emergency was what my clinical background was, and then had the opportunity to move into management. And from there, it was more methodical of, going on to graduate school, and business is my non-nursing education.
I see. Did you like the ambulance work?
I did. It was. I'm still passionate about it. I'm not clinical anymore, but really enjoyed that adrenaline rush, as well as getting to really help people when they were at their weakest, if you will. And that's what, truthfully, that same attitude is what drew me to this area. Is I wanted to be at a hospital where I'm closer to the patients, their families, the staff. I like being down in the weeds.
Yeah, well, we got a great hospital here, that's for sure.
We do.
And where did you, when you started getting into the business aspect of it, where did you go first?
So the first place I went actually was to Virginia, and the reason I did is it was a career promotion to move into management, as well as that's where I went to grad school, and there was the university connection in Virginia Beach at Regent University, and raised my kids, went to school for, like I said, my MBA, raised my children, and then also moved into management on a departmental level. And then I joined a company that operates similar hospitals to here, but they have a lot of them throughout the country, and that meant that every 2 to 3 years they moved you to another one. So
you'd go
relocated a lot.
Help a hospital.
Very similar.
Get it reorganized or whatever.
That's exactly.
And do that.
And then once it stabilized out, they moved me to the next one. And so that was a great career. It gave me a lot of experience and a lot of fun. But then 4 or 5 years ago, we raised our children and said, where do we want to be permanently? And due to some connections I have in this area, we started keeping our eye out. And then this this opportunity came open and it was a fit, and I fell in love with the hospital, the people, the town.
Well, that's great. Yeah, we're glad to have you. Now, what's your wife's name?
My wife's name is Belinda.
Belinda.
And her background, she was a lab tech for many years and then raised our children. She homeschooled all three of our kids, and now she does volunteer work and supports me.
I'll be darned. And where'd you guys meet?
Met at college, actually. There's a long story I'll tell you sometime, but by fate or accident, however you want to say it, we met through the janitor. And he introduced us to try to get me to come visit church.
Oh, yeah.
And then we connected and have been together. That was in '89. We've been together ever since.
I'll be darned. And then how about your children?
So I have three children. I like them, but I have a new grandbaby that I love. My children are all adults on their own. One in Texas, kind of where my family's from, and then the other two and their families are in the Denver, Colorado area, which is where we moved from, is Colorado.
Okay. Did you snow ski?
Not really.
No.
I love going to the ski resorts and watching other people come back on crutches, but skiing's not been one of my personal hobbies. But I do like ice fishing and snowshoeing, that type of thing.
It's beautiful country though.
It is. It is.
The air's so clean, the water's so clean and good, fresh. So your kids are grown, you got a grandchild, and now this is going to be your roots.
It is.
You're going to be here for a while.
You just summed it up well. We really have focused on my career, but also on raising our children. We wanted to focus on them, and now that they're completely on their own and raising their families, and just the nature of my wife and I's family, it's very non-centralized. So we had the opportunity to pick where we wanted to be and put our permanent roots, and very happy that we've chosen Jersey County, and we have us a little piece of land. And really are glad to be here.
Where's your land? You got like a little ground with some house and everything?
It's very small. It's only 5 acres, but it's about 10 minutes from town, which is a wonderful commute. It's out in the country, but real easy to get to the store and work.
So being from Texas, I guess you're going to fence it in, put a couple horses out there?
Not horses, no, but I'll use the land for, I like to play farm because I'm not really an ag, but I like to play at it.
Okay.
So we'll continue to grow it as time goes forward.
Tell me a little bit about the services. I know we've got some great services here. Since you've got here, what have you learned? What do you like to share with us?
The great thing about both the community and the hospital, because they really do go together, is that this is a very independent, self-supporting organization. And unlike really any place that I've been, so many of our employees and patients they're either related, they grew up together, they're friends, long-term or short-term, but it's very interconnected. And it is so great to watch all of our clinicians and the support staff really taking care of their own, whether that be, like I said, family, friends, but it's personal. And also, granted, we have some people who commute in from outside, but it's the minority compared to really anywhere else I've been. It's been the other way around, where most people commuted into the community, and we had a few that are from there. And so that's just a wonderful trait that we have, and it really bodes well for our longevity and success. As far as our services, we are primarily the primary care for patients. Their regular doctor or provider taking care of their ongoing chronic or acute needs, and then specialists up to what we can support. And we are limited from a size standpoint that we're not going to get into neurosurgery. But you support a lot.
You got a lot. We got a lot here.
We're not going to get into neurosurgery, for example.
Right.
But orthopedics, urology, women's services, any of those type. Podiatry is a big service of ours. We just added Dr. Che. He's the newest member of our team. And then, we have a pretty good segment of our services that are tied to behavioral health in one way or another. And that can be ranging from people that are having some emotional challenges and need help, whether that be counseling or the medicine side. And then also it's the nature of our society that we do have people that are challenged with substance abuse, and
Yep.
we have a segment in behavioral health that really helps individuals, live the best life possible, dealing with chronic, pain and issues. So, great services. And then our primary care are heavily family practice, which means that they take care of all your needs instead of, just necessarily the medical. You could have an injury or whatever, and they're equipped to take care of that, which is great in our area.
Yes. Hey, if you're just joining us, I have Kevin Zachary with me. He's a newer CEO for JCH HealthCare. Kevin, how about the staff?
Wonderful staff.
You've been to a lot of hospitals.
I have.
All right? You've been around a lot. So how do you compare our staff here?
I would definitely put them as top notch. And part of that is the skill. That's very important, that we make sure that all of our staff are trained, competent, and that doesn't matter whether they're in the registration side or whether they're in the caregiving side. All of it's important to the overall picture for our patients. So they're very high skill, but the special is how dedicated they are.
Yeah.
They really are dedicated to JCH as an organization. They're dedicated to their coworkers, and they're dedicated to their patients, which largely is their family, friends, and local neighbors. And that's just a trait that you don't commonly see. And it's really enlightening and refreshing to be around folks, and they've welcomed me in with open arms.
Yeah. What have you saw in some of the other not listing names of places, but in general, what are other, we take this for granted, of what we have here, but what is going on at other community hospitals?
Hospitals of our type fall into two categories. And the second one is us. The first one is, and it's more common, is they're basically a service provider that you go in, you need blood drawn, or you need taking care of an illness or physical, and they provide that service, but you don't have that emotional tie. You don't have a connection. And that's where the second one is. And that's what JCH, and that's really a partnership in the health of your, in your health and your lifestyle, and more focused on the individual's needs than just the service they're looking for at the time. And unfortunately, healthcare is getting harder and harder to economically provide.
Yeah.
And as a result, a lot of, especially your smaller facilities, are getting more service-based, where it's all on the service they provide so that they can afford to do it and get a return, not the overall picture of the community and the and the individual's needs. And that's what's special here. Is you talk to any of our physicians, our providers, our nurses, our registration clerks, is they really care about the experience that the individual has in making sure that within our ability we meet their overall need, not just the specific service that they've come seeking.
One thing that I think we're fortunate for a lot of things, but the wellness center, it's so nice to have that wellness center that we have here in the community. I mean, it is just so great to have that.
Chris, that is an amazing draw that when you ask what we have that others don't, that is unusual, highly unusual for a community to be able to provide that. And, that helps with the wellness, but it also helps with people's emotional needs, because there's some that's their socialization.
Yeah.
It also provides a healthy avenue for them to be active, learn new skills, whatever. But it's a busy wellness center.
They offer so much there.
They do. Yeah, and you talked about services. They range from all different athletic type classes or exercise classes, water aerobics. There's actually a game club, like tabletop games for the socialization side. But then don't downplay. We also offer massage therapy that is very popular, and a lot of people take advantage of that service. That is nice to have. And then in the corner is our outpatient physical therapy department,
which is super.
That are second to none.
Yeah, they are super
shining stars.
Yeah, I had to make a visit there too, and that was they healed me up. It was a tough one, but they got me healed.
Yeah.
another area that I think is we're pretty blessed to have, and that's the heart department.
And they are very active, been with partners with us for a long time. And similar to what I was saying about the hospitals, can either be service, providing a service or helping match up somebody's lifestyle with better living. And they are very much in that second category. They've been a partner with us as a hospital and as a community for a long time. They offer many services, both from screening and also treatments that really keeps people local.
Yeah, you don't have to go to St. Louis.
Yeah, and as a general rule, if somebody needs active treatment for cardiac, they're probably not in the very best condition to go out of town if it can be avoided. And to have it right here local that has its own entrance that, patients can go in, be seen, not feel like they're really in the hospital as such, and get taken care of, whether that be a screening, a treatment, or a medical evaluation. And they do a fabulous job.
Now, it seems like, is it tough to find people? I know there's not a lot of, there's not a lot of people available these days.
That's been a pleasant surprise. Yeah. I came in anticipating exactly what you're saying, and that is every time you have a vacancy, it's just going to be, doing nationwide searches trying to find somebody, and that's not really proven true, not across the whole board. We have different individuals ranging from caregivers, support staff, and leaders that positions have come open we thought were going to be more challenging to find candidates, that local candidates popped right up, that maybe they're commuting out of the city, but they want to stay, local, or they're already local doing something else. And it's been a great fit. Now, clinicians are more challenging because as a general rule, the local clinicians that are from here, trained, whether that be a nurse or a lab tech or nurse aide or whatever, they're already, for the most part, they're already working here or one of the other healthcare providers. So getting individuals and recruiting a little farther out and bringing them in, that's where the challenge comes in. And then when you get to physicians, it's really challenging because we just don't, we're not of size and scope to have a local medical school, for example. And so you have to recruit from outside. And then it has to be somebody that they want to be in our environment. They want to be rural providers, and they want to be closer to the patients than you would at a big academic center.
Right.
So
how many people does the hospital employ?
So if you count total bodies, whether they be full-time or whether they be part-time, it's about 425. If you count people that are full-time, it's in the lower 300.
Okay.
And that's across all of our clinics, our ambulance, our, the hospital, all of our, the East Annex. We got a lot of tentacles out that people may not think about bigger than just the physical hospital itself.
With that many people, are you always recruiting?
We're always recruiting.
Always recruiting.
We have a low quantity as a percent, but we're always looking for skilled staff. I'm careful to say it's not just clinicians. It's anybody that has a unique talent, that maybe they're a coder or something such as that. We're always, looking for what's available and how we can connect if there's a need. And so, that's a never ending effort.
What's a job that, or a position that, people are looking for, you're looking for, that maybe if somebody's listening and they go, my sister could do that, or,
from a physician standpoint, I ask every group that I've had the opportunity to meet, what services are you having to go out of town for? And I would say dermatology is the number one that's brought up, that people would like to have, because it's hard to get appointments in the city for dermatology also. That's also one of the hardest areas to recruit to.
Is it?
It is very, very challenging to get dermatologists. And we know that some of our medical staff have voiced that, they would like to retire at some point. So backfilling, nobody we're looking for right now to start right now, but we know, it's coming. So, for example, urology, we know there'll be a point where we need to bring in a new urologist. That's another one that's, I would say, tied for number one hardest.
Is it?
It is. It's challenging to find them. And then, really any of the surgical practices is in the more challenging area because they're more specific. And so if you don't have a high population to support it, it's harder to blend those together versus your medical care. Everybody needs medical care. They may not need an orthopedist, for example. And so it's easier to justify. But really, there's not any area that we're not at least open to discussing if somebody's in the area.
I know we're in the holiday season now. Was the hospital, the staff able to do any celebrating at all?
Yeah, we've had a lot of fun this year.
Have you?
Being new to town, my wife and I and our children on their own. We Thanksgiving, for example, and we're doing it at Christmas too. We celebrated personally by going up and hanging out with the staff and serving them lunch and dinner, and that's something that I find fun when we're in town to really say thank you, and then was able to be involved with a lot of traditions over the last week, specific to Christmas, whether it be different dress up events or serving mocktails. That's a tradition that we like to serve the staff. A lot of it surrounds food.
Okay,
And then also giving back to the community, through like food drive type. We did a food drive around Thanksgiving, tied with the 5K, to where we can give back and try to help the less fortunate.
Yeah, well, that's great. We're going to wrap this interview up. Any words you'd like to express to the listeners?
Really just thank you to everybody for your support. That's both obviously on a hospital level, but I'd like to tell you and others, for my wife, Belinda, and I, thank you very much for just welcoming us with open arms. We understand we're the new face, but we very much look forward to this being our home and appreciate everybody just pulling us in and look forward to getting to know everybody.
Well, thanks for coming in today, and it's been a pleasure.
Thank you so much. Happy holiday.
You too.